One coin with two sides. First side. Health is a dynamic equilibrium, regulated by its own norms and maintained by the same physiological processes as disease. Second side. Disease is not the absence of health, but another phase of the same biological reality, with its own changing norms. Medicine has long operated on a flawed assumption that health and disease are opposites. Eliminate disease, the logic goes, and health will follow. It sounds reasonable. It is wrong, and the consequences of this error reach into every corner of clinical practice. Health and disease are not opposites. They are two expressions of the same biological reality, realized through the same physiological processes, measured on the same continuum. Treating them as enemies rather than neighbors distorts how clinicians think, how they measure, and how they treat. The most concrete distortion lies in clinical norms. Disease has its own norms, dynamic, stage-dependent, shifting as the condition evolves. Yet medicine routinely judges a sick person against the standards of a healthy one. This is not a minor calibration error. It is a structural mistake that produces misdiagnosis, inappropriate targets, and treatments optimized for the wrong goal. Consequences for clinical practice consists in misaligned treatment targets, aiming to restore healthy values in an acutely ill patient may actively harm recovery rather than support it. Ignored disease norms. Each stage of illness has its own optimal range. Failing to define these means clinicians lack benchmarks for what a good disease course actually looks like. Prevention without a compass. If the optimal trajectory of disease is undefined, prevention has no clear destination and chronic disease management loses its logic. Blocked innovation. Framing health and disease as opposites closes off entire avenues of inquiry, particularly in understanding how the body heals itself. Please press likes button. The path forward is not a rejection of existing medicine. It is a rethinking of its foundations. Recognizing disease as having its own dynamic norms, and defining the optimal course of illness as a clinical benchmark, transforms how we prevent, diagnose, and treat. The criterion for success is no longer merely the absence of disease. It is the presence of the best possible trajectory through it. Health and disease are two sides of the same coin. Until medicine treats them as such, its frameworks will remain incomplete, and patients will continue to bear the cost of that incompleteness. Thanks for likes and sharing.